I am a physician, as you know, and when I was in practice, lots of my patients were using over-the-counter agents. Some of them, because they had no other reason to be taking other medicines, they had difficulty even finding physicians who would prescribe things for them. Can you give me some idea of the over-the-counter medicines that you were required to take?
I was tried on a lot of different medications, and I had a lot of reactions. And what I found out was if I just took ibuprofen, and I was taking 4 pills every 4 hours for several years, that I wouldn't get any, reaction to it. I wouldn't break out in hives or anything. And that helped me through the periods until finding the medication that helped me. And then later on, I use a lot of herbs, vitamins and supplements, but I go to a herbalist, and she's also a nurse, so she's able to see the medications I'm on, and then to tell me which ones are okay for my body. Yeah.
But Gwenn, let's back up for a moment. What adverse reactions did you have initially to many of these over-the-counter medicines that you had to use?
Well, just to put my wife's story in context, she had her pain started when she had a car accident in 1995, and she was given a lot of different medications. Initially, the doctors were prescribing some pretty heavy medications which had some bad adverse reactions, and that's when Gwenn started to switch to the over-the-counter medication as a supplement. And one of the medications gave her very severe stomach cramps in the middle of the night, and one gave her sort of almost like twinges. How would you describe that?
Yeah, shocks. I had tremors, and I had a seizure from one medicine, and then one medicine gave me an unbelievable headache where I thought my whole skull was going to crack open.
But Malcolm, since your wife had been injured, you must have taken her to many of her doctor's appointments. So I'm wondering if the doctors actually advised you about the potential side effects of these medications.
No one ever asked me what I was taking, over the counter. No one ever asked me, so.
So when you developed this side effect with your stomach, I think you said you had some stomach bleeding?
Yeah, yes.
The doctor had not warned you that that was a possibility?
Well, they didn't know that I was on it.
Well, now, in my practice, I always kept a very active list of the medicines that my patients were taking. And my staff knew that they had to ask the patients or the family members, what medicines are you taking besides what Dr. Bivins has prescribed? And so we kept a very active list that we even changed if we had phone calls with the patient. But you're saying that didn't happen in your case.
No, I mean, my present doctor does that now. But many of the doctors that I've been to, my husband came with me, they wouldn't even give us 15 minutes. They'd just be standing by the door like this, and they would be trying to figure out what they can give me next. And if I didn't heal or respond properly to the medicine, it was almost like it was my fault, that there was something wrong with me.
So
Yeah.
what does that do for you with regards to trusting your physicians? Obviously, you had difficulty trusting this one physician who wouldn't talk to you. But then you found a physician who listened to you and who was willing to sit down.
Yeah.
So let's talk about the trust that you have.
Yeah, no, my present pain doctor is fantastic. I feel like he's a team member. He sits, he talks to me. I bring in my list of questions. I always bring in a list of questions because my memory's not that good. And this way I could just, tell him, and then he'll say to me, what's on your list? And we go over it, and then I write everything down. And he's a team member. And in the beginning, Malcolm came, to the meetings with us. And after a while, I feel comfortable with him, so now I can go in by myself and just talk to him.
When I was in practice, I often encouraged my patients to bring lists. And that was so unusual for most of them. The physicians did not want to hear the long list that they seem to create.
Yeah.
But you have a physician who's very willing to do that.
Oh, yeah, definitely.
So how do you interact with your physician? Do you do this by telephone with any frequency, or is it just at visits?
Visits and email. Sometimes I'll just email him. Like, say if he put me on a certain medication and I have to up the dose or put it down, I could just shoot him an email, and then he'll tell me what to do.
How would you advise other patients to develop that sort of a trusting and open relationship with their doctor?
I mean, it's really hard because people are always asking me that. And part of what we do in our support groups is that we have a referral list. And it's usually people from the groups who have seen a physician that's really open and, you know, is willing to talk about their problems and help them solve it.
Often people feel that they can't switch from one doctor to another for whatever reason. But I feel from what we learned from Gwenn was that you have to go to the right doctor.
What I'd like to do now is to focus again on the medications that you've been taking. You had told me earlier that you were on rather large doses of ibuprofen.
Yes.
But that you had also moved away from that and were going into some complementary medicines.
Yes.
So how now do you use the over-the-counter agents that you have access to?
Well, I talked to my physician about it, and he's recommended certain lotions or ointments I could put on, you know, my body to help with the pain. I could buy it, you know, through my massage therapist or, you know, through different places. The herbalist that I do use works in his office, so he's aware of what she's prescribing. And since she's a nurse, like I said before, she knows what to give me. So I really have it monitored now. I make sure that everything works together because I am on medications also.
But Gwenn, let's make a comment here. When I think of over-the-counter medicines, I don't often think of herbal preparations and lotions. So I think other patients need to understand that there are options available to them that aren't necessarily prescription options.
Yes, yeah.
So can you explain that a bit more? What sorts of lotions or herbs do you use?
There are certain vitamins or supplements that are in, you know, the stores, grocery stores, and it depends on their life. You know, sometimes if they've been on the counter too long, then they lose their, you know, their importance. I've learned to use certain brands of vitamins, supplements. I have a tincture that's made for me with different herbs, and it's from a place that's organic, and they have a really good reputation, so I know that tincture is good. So you really have to do a lot of research on, you know, different vitamins and supplements you're going to be taking.
So Malcolm, were you or Gwenn told that ibuprofen or medicines in that class can create liver damage or can create kidney damage or cause high blood pressure? I mean, you're aware of the gastric bleeding, but were you ever informed of these others?
Well, we never really talked about the ibuprofen, but I mean, there were medications NSAIDs that I did take, and I was told about those, you know, the possibilities that something can happen, and then to let them know if something happened. So the legal medications, I was told about that, but it wasn't asked what other things I was taking at the time. But I was just thinking of another instance when I had a fall and I was on a certain medication, and I broke out in hives for some reason. I can't remember exactly. It's before they found out that I have an intolerance to cow's milk. So we went to the local drugstore and we asked for something for the hives, and I asked them, I said, could you look on my record to see if this over-the-counter medication will go with my medicines? And she said, oh yeah, they're fine. And then what happened was that I took it that night, and it just did something, the combination of the over-the-counter medicine with my medicine interacted, and then I passed out and I had a really bad fall. And then that broke out in more hives or something, I can't remember exactly. So it was even going to the pharmacist and asking them, that was also dangerous. So it's really tricky when you're taking over-the-counter medicines and prescription medicine.
So does the average person, as you know, I'm from rural Virginia.
Yeah.
So does the average person in rural Virginia have access to the American Pain Foundation website that you mentioned, and to the chat rooms? Do they have access to that?
Well, it's free, you know, to anybody. And all they have to do is just go onto the website, painfoundation.org, and they look for the button that says Pain Aid, and they just click that and they sign in.
Well, this has been a very informative time, and I appreciate the time. I know you've been a bit uncomfortable physically during this interview, but I do appreciate your coming.
Yeah, thank you very much.
I hope that you continue to do well.
Thank you.
Thank you.
Thank you.